71 cases are interstate arrivals to the Northern Territory. We don't have any cases in international arrivals in that reporting period, and 191 cases are under investigation by our authorities. We have got 1,200 active cases of COVID-19 in the Northern Territory. And I can provide a little further update on the figures we announced yesterday. We reported that we had 27 cases of community transmission. That number has now risen to 38, but those investigations are continuing, so I expect that figure to continue to rise. Of the 412 cases overnight, 120 of them were off a positive RAT test, that rapid antigen test, and they will be confirmed by a PCR test. And I did explain to the community earlier this week the process. We do accept a positive RAT test and we start caring for that person that they have COVID, but we then confirm it with a PCR test, but we reconcile our data so we're not double reporting. So just important information there for Territorians. There was 2,810 tests processed in the last 24 hours, and I'll just provide a little bit of regional breakdown for Territorians. I know that there's people right across the Northern Territory who are watching this update, and it is fair to say that we have COVID in every region of the Northern Territory, and so people, when they leave their home or they have visitors to their home, they should be prepared that they're at risk from coronavirus. Pleasingly, we've had no more cases from Yalara, and in Alice Springs we've got 22 cases that we've reported in this period of time. Tennant Creek has got 1 additional case. Katherine, we're still working through our figures, but I can provide an update to the residents of Katherine that there's no patients in the Katherine Hospital presently, so we saw the transfer earlier this week and we haven't had any more admissions. And Nhulunbuy, we're still doing that investigative work to look at the cases. We have had fluctuating case numbers in Nhulunbuy. It's fair to say that the large majority of cases are in the Darwin region of COVID-19. In terms of hospitalisations, I'll touch upon that, but Dr Marco will provide more detail. But there's only 19 cases in Territory hospitals, and the large majority of those are for reasons other than COVID. We do still have, sadly, 2 people in intensive care and 1 person is on a ventilator. In terms of today's numbers, I can acknowledge to the community that is concerning that we've had significant escalation in the numbers, but we expected this. We're doing large amounts of testing, we've got community transmission, but these numbers are not, we can still manage these numbers that we're seeing, and I expect these numbers to grow over the coming days. But looking at those hospitalisation figures ensures that we have confidence in our system. So that's the important message for Territorians today. Our community transmission rate will continue to grow, but we have got public health measures to slow that spread of COVID-19. So we're in our lockout right across the Northern Territory. Those people that are at high risk of spreading the virus and becoming severely unwell, those that are unvaccinated, can only leave home for those 3 essential reasons, and we have got the mask mandate in place. There were some questions around the lockout, around maps going to be produced. The lockout is territory-wide, but people can travel within the Northern Territory if they're fully vaccinated. So a fully vaccinated person from Darwin can travel down to Alice Springs and vice versa. The only restriction is around those remote communities. So if you are feeling unwell, please stop, isolate yourself and reach out to get tested, whether that's a RAT test or whether you attend one of our testing centres. If you are vaccinated, please check, are you ready for your booster dose? We have got appointments available, and we saw that criteria change earlier this week, meaning many more Territorians are now eligible to be boosted. And we've also got the children's vaccination opening up next week, so an opportunity to give children a dose before we head back to school. I just want to take a moment to talk about Alice Springs briefly before we take questions or before I hand to Dr Marco. We received reports that at least 6 employees at the East Side IGA in Alice Springs took those RAT tests and they returned positive. The IGA to be applauded. They worked independently of government. They encouraged a staff member who was unwell to take that RAT test, as I understand, and then as other people became unwell, they made the decision to close their business. And we've had some questioning around those figures. So they were RAT tests. I understand PCR tests are now being undertaken. And so why it's not being listed as an exposure site is that that work is still taking place, but that business should be applauded for taking steps to slow that spread of COVID in the community. So I'd like to thank the IGA and the employees, and that's what we need to see more of across the Northern Territory. Our teams are working around the clock. There is testing available, but there is a simple message. If you start to feel unwell, just stop and isolate, and then reach out to the COVID hotline, then get yourself tested, and then the appropriate steps and mechanisms will start to take place. But the best thing you can do is remove yourself from the community. Don't take it as an opportunity to do all those jobs on your to-do list and potentially spread COVID. So just really congratulate the IGA in Alice Springs and other businesses that are taking steps to protect the Territory community. So the COVID hotline is available, and we have provided additional staff onto that COVID hotline, so they will be able to answer any of your questions. We're also updating more information onto the coronavirus.nt.gov.au website. We're particularly putting information about people preparing to live with COVID and to have COVID, what you can do, the steps you can take now to have some items in your home that will ensure that you are comfortable whilst you are unwell, and as we step towards more people having COVID in the Northern Territory. So I know today's case numbers are high, but it's not a surprise. The reassuring part to us is around the hospitalisations. So I'll now hand to Dr. Marco to provide some comments, and then we're both happy to take questions. Thank you.
Thank you, Minister. I would like to acknowledge that we are obviously concerned about this increased number of cases in the last 24 hours. I want to reassure the community that we are working arduously to slow down the spread and to care for these cases safely. The somehow good news at this point is that despite this exponential increase in number of cases, we are not seeing an increased number of acute hospitalizations, and we are not seeing significant pressures in the hospital service. I want to acknowledge the arduous work that our healthcare providers are doing day in and day out to maintain our health services able to care for you, not only for COVID-related matters, but for other health matters as well. It is somehow always concerning, as the Minister mentioned before, that we have now COVID in all regions of the Territory, and all regions are working quite hard to make sure that that spread is contained. With regards to hospitalizations, I want to expand a little bit more about that. Of the 1,200 active cases that we have in the moment in the Northern Territory, only 5 of those cases are requiring an acute hospital admission. We have another 14 patients, or 19 in total, that are in our hospitals, but they are in hospital for different reasons. So 5 patients are in hospital related to COVID, and 2 of them are requiring critical care support in the ICU. One of them is intubated and ventilated. I want to reassure that despite this, as I said before, we still have plenty of capacity in our hospitals to care for Territorians in this moment. I think it's important to emphasize that of the 412 cases that we experienced yesterday, the vast majority of them, 281, which is 68%, are between the ages of 20 and 40, which means that this age group of Territorians and visitors are encouraged to please be extra vigilant and extra careful, and to adhere to public health measures to slow down the spread. If you're not vaccinated, get vaccinated. If you need a booster, get your booster. If you are up and about, then please wear a mask and wear a mask properly, practice social distancing and stay safe.
Minister, you've just applauded the IGA for taking their own initiative, but really what that illuminates is just how poor contact tracing is to not even list an exposure site in Central Australia that your government did list as an exposure site in January too. People are having to take on contact tracing on their own bat. Why isn't the government doing their job here?
The government is absolutely doing their job. There is hundreds of public servants and frontline workers that are working around the clock to keep the community safe. But we are going to see an increase in case numbers across the Northern Territory, and we need people to take that personal responsibility to protect themselves, their loved ones and the broader community. So what we have there is we had people that took RAT tests, they tested positive, and when they had a number of those tests come back positive, they took that additional step of closing that business so that they could ensure that their staff could all be cared for and that appropriate measures can be taken. What you will see is those people will now get PCR tests. The contact tracing teams are working with them, and you'll see that update to exposure sites. But I come back to the point that I've made continually over the last week or so. Every time you leave your home and go somewhere in the Territory, every time you have someone come to your house, even if you know them and you know that they're double vaccinated and they're someone that you don't think would have COVID, there is a risk. And we're starting to see that in our community as we hear of people that have tested positive, and you start to think of the interactions with them. So we have COVID, as we said, in every region of the Territory, and people need to make sure that they protect themselves with the public health measures that we just heard from Dr. Marco.
Rapid antigen tests are enough to be listed in the daily case updates. They're enough to let international travellers in. Why are they not enough to be listed as an exposure site?
So I'm happy to take that away and get that advice from our health authorities. But what we do is we do follow contact tracing, and there is a formula to that. It is a clinical process, and so we put those RAT tests in our daily numbers. I explained previously how we reconcile them with the PCR tests, and then decisions are made on that. But I'm more than happy to ask if that can be counted in that exposure site information.
Are there any plans to create a centralised system to upload rapid antigen results?
I would have to seek advice on that if there was it. But we certainly encourage anyone that's taken a RAT test and it's tested positive, the first thing they should do is isolate, call that COVID hotline and make an arrangement for a PCR booking, and Dr. Marco may provide further comment on that. Yes, Miles?
Airport rat supplier, Alice Springs Airport. Your police commissioner yesterday said he'd get to the bottom of it. The police media then bypassed the ABC onto COVID media. The COVID media of the NT government still hasn't provided a response. This is a key issue about supply of rapid antigen tests. When are people and the public going to get an answer from government on this?
Well, I'm happy to provide an update, and I apologise that you were passed between government agencies, but I understand there is no supply issues across the Northern Territory. Alice Springs Airport, Darwin Airport, all of our regional centres, we have a regular supply of those RAT tests, and we're making sure that we're managing those supplies, getting them out to the regions appropriately. So there is no need for people to panic and start keeping RAT tests. There is supply. We do need to be conscious that they have to be kept below 30 degrees, and in our climate that can be a challenge. If you need a RAT test, we will make one available to you.
How many of today's cases are healthcare workers in our hospitals?
Yeah, I don't have the specific today how many, but I do have a figure which I can share with you. We have approximately 30 staff in NT Health that have tested positive to COVID-19. The large majority, in fact, I think it's all except for one, which was the nurse in Catherine, which is under investigation. We believe they may have gained their COVID from the workplace. All of those cases are from interstate travel or close contact. So we have around 30 staff territory-wide who are COVID positive, and we, of course, wish them, like every Territorian with COVID, well.
How many health workers have then been identified as close contacts to those 30 cases?
Yes, I don't have that figure. I can certainly, an important message for people that may be watching this, last Friday the Chief Minister announced those changes to close contact timeframes and people testing positive. All of those CHO directions are up on the website, and so we're now working through with individuals to make sure that they undertake what is required to keep our community safe, but we also minimise disruption to them and their families. But in terms of that specific, I don't have a figure for health. I have the figure of 30 people that have tested positive.
Are you concerned that health staff, especially the ED at Royal Darwin Hospital, say they're at breaking point? Are we going to do anything else to support them?
So we have got hard-working staff right across the Northern Territory, and we've seen throughout COVID they've been agile, they've responded, we've got strong plans in place, but we acknowledge the hard work that they're undertaking each and every day. And when I talk about hard work, what it means is that there is additional PPE that they may have to wear during their shifts. There's additional cleaning between patients. It's not simply just calling in the next patient and changing the bed linen. There is, disinfectant processes. So there is these additional aspects that COVID we're all living with in our everyday life, but particularly for those, and it's not just our doctors and nurses, it's the PCA, the administrative staff that support them, and so we have continued to support them. We keep seeing changes, and we'll continue to see changes in our management of COVID. We particularly need to make sure that our health facilities are functional and that we make them as safe as possible.
How many of those hospital staff of that 30, can we get a regional breakdown to understand which hospitals and how many staff each of them are missing?
Yeah, so I'm happy to seek that advice. I understand the very large majority are Royal Darwin Hospital. And I think it comes back to the point that Marco's made around the age group. I think Territorians should take note of that. That 20 to 40 age group is where we're seeing the vast majority of these cases. And so we again remind people to make sure those vaccinations are up to date, and really when you're out and about, make sure you wear your mask, extra hand sanitizer, and try and physical distance as much as possible.
We're assuming that 50% of cases are Omicron, and we've been told that Omicron has a lesser hospitalisation rate.
Yeah.
Under the NT's own model, how many cases of Omicron are expected to result in hospitalisation?
So I'll hand to Dr. Marco to provide some information around the Omicron. We're certainly seeing from international and national briefings, health ministers were briefed earlier this week, the hospitalisations are far less, as you just stated, but we're certainly seeing significant case numbers, and so we need to make sure we manage those as people have the illness. So I'll hand to Dr. Marco to provide some comment on that. Thank you.
Can I just get you close to the microphone?
Sure. So with regards to Omicron and severity and need for hospitalization, what we see internationally and in other jurisdictions is that it appears to be of a less severe disease. However, we see a larger number of cases because it's more transmissible and is unfortunately being passed on to everyone in our society. However, what we're seeing is a mild disease that requires less pressure on the hospital system, and therefore something that we're expecting to manage.
Just on that though, Omicron seems to be more virulent than the Alpha strain, which absolutely decimated hospital systems across Europe and much of the world. As well, what seems to be missing from this analysis is that hospitalisations are often delayed in terms of uptick in cases. So while we may be happy now, isn't it the case that really the worst news around hospitalisation is actually yet to come?
I think that's a very fair comment, and I think what we've seen is that when we had Alpha, we didn't have vaccination, so we faced the Alpha outbreak with no tools at our disposal to fight this off, and unfortunately that had the terrible consequences that we saw around the world with COVID when it first hit us. The great advantage that you have now is that we have a highly vaccinated population. We have vaccines that have proven to work in decreasing transmission, but more importantly to decreasing severity of disease. And we've seen that with boosters, the effectiveness of those vaccines against Omicron is as good as it was before this Omicron strain came to the picture. So it is good news in the sense that we have tools to fight this virus now, but we are watching that very closely. We are learning about Omicron as it comes. We have the opportunity to see what other jurisdictions nationally and internationally are learning from it, and we are very proactively putting plans in place to manage.
And just on that, you mentioned other jurisdictions, because they're having majority Omicron strain rather than that split, and they're still having hospital systems overwhelmed. Often when they have, albeit a large population, a lot more tertiary hospitals to deal with this. How can we be sure that our hospitalisation really is at a good rate, given there is often that delay around hospitalisation?
What we see in many other jurisdictions, the overwhelming issue is not necessarily being bed capacity, it's being staffing. We've been very aggressive in protecting the public inside hospitals from hospital-acquired infections, and we've been very aggressive of removing our staff away from front line to protect hospital staff and other patients from getting COVID inside hospitals. The negative aspect of that is that we see in hospitals that don't have enough doctors, nurses, cleaners, PCAs, admin staff to operate safely, and that's putting enormous pressure on hospital systems around the world. What we are working on ASPPC with National Cabinet, what we're learning from international experience is that we need to have a more practical approach, perhaps a better balanced approach to keep our patients safe and our staff safe from COVID while we maintain essential services open.
We've heard, though, that we're modelling our response to these alarming case numbers off the fact that we're assuming a lot of them are Omicron. How many are expected to result in hospitalisation given the known demographics of the NT?
Based on the vaccination rates and based on what we've seen so far, we are expecting that the NT will behave similar to how it has behaved in other jurisdictions. We, however, know that we have our own specific issues about distance and about vulnerable population, etc. Those have been factored in the modelling that we're putting forward for plan.
In terms of, you mentioned just earlier, maybe this one for the health minister,
yep.
I'm not sure, but health staff is something that's critical to maintain and manage. We've already got 30 cases of supposedly unknown amount of additional staff unable to work as their close contacts. How are we going to manage that in the territory?
So, as Dr. Marco said, a lot of work is being undertaken at AHPPC, making sure that we keep people clinically safe and we care for people. But we certainly have resources that we can call on, such as the National Critical Care and Trauma Response Centre, that can provide us with support. But what people can do is they can ensure that they're vaccinated and they can ensure that they follow those public health measures, but they can be confident that even as we see these case numbers rise, the hospitalisations, we're not seeing that increase, and we've got strong plans that we can put in place to ensure that we provide for the care of our staff and those working in our health facilities.
The NT government is going off the
We'll just have a couple more questions, thanks.
Where 95% vaccinated. The federal rate has us at 84% vaccinated. Could that explain the high rate of reproduction rate that we're seeing? 4.5, I believe, was the stat from around yesterday.
I mean, we have a highly vaccinated community. What we do have is some pockets of hesitancy, and I again urge those individuals to please come forward and get vaccinated. It is safe, it is effective, and so it is our worry in those communities where we have little vaccination coverage, and that's why you saw that extended period of lockdown in Tennant Creek. But we have got a highly vaccinated population. Many people are getting their boosters. Those timeframes have changed and will change into the future, and meaning more people are eligible to have that vaccine protection, bringing our children online. So in terms of the figures, we've always said that there is room for error in those figures, but we do have a highly vaccinated population.
Is it concerning, though, that there's a 10% discrepancy between what the feds and what the NT government is modelling the response of?
So to provide a response that we provided months ago, we, in terms of the formulation, we know who we've vaccinated, we know the parts of our community that are vaccinated, and with respect to those Commonwealth figures, they've used a model that just doesn't work on a small transient population in the Territory.
If only 5% of our population is affected by a lockout, is it really going to help?
So we have got a very small percent of our community that will not listen to medical experts such as Dr. Marco, our Chief Health Officer. They won't listen to AHPPC. They think that somehow they know better, and so unfortunately they are a risk to themselves and they are a risk to our community. We know that unvaccinated people, the transmission is greater, and that is why we've had to take this step, looking at these rising case numbers to protect our community, a public health measure to protect them and our community. And as we said, we'll have a lockout and then we'll transition to a vaccine passport.
Do we know the percentage of...
I'm going to take one more from each people.
Do we know the percentage of unvaccinated people getting infected at the moment?
I'm happy to seek some advice on that and provide it. Last question, Miles.
Maybe one we can get on camera then around the total number of active cases in certain regions, if that may take some more time.
I provided the overall figure of total active cases in the Territory. As you can see from these figures, and we have got work that is happening around the clock. We've got contact tracing that is having an initial phone call with people to let them know that they have got COVID, to tell them that they need to isolate and to ask them some initial information. Then we're going back and doing those detailed contact tracing interviews. But as those case numbers rise, and particularly if we know that someone is safe from spreading the virus in the community and they're being cared for themselves, it's not relevant in terms of, you know, that time. We do need to make sure that we focus our health resources. I did promise Amy one more question, so she's happy to hand it to you.
French President Emmanuel Macron said that he wanted to piss off and make life difficult for people who have the opportunity to get vaccinated and not do it. I wonder, is our strategy in the Northern Territory similar, that we want to really say if you're not going to get vaccinated, there's going to be significant consequences in life?
I won't cause an international diplomatic incident and comment on the French president, but what I can say is that it's based on the health advice. People that are unvaccinated are more likely to spread COVID through our community, and they are more likely themselves, if they catch it, to end up in hospital on a ventilator in ICU. So I urge any Territorian, we won't ask questions. Just go online, make your booking. You don't need to be stubborn about it. Our health professionals, they couldn't care less whether it's your first dose, second dose, booster dose, your children. They just want you vaccinated to make their life easier. Thank you.
Thank you.
Just a clarification on pronunciation of your name.
Yes.
It's pretty same.
Should I? Can I ask you the study?
Yeah,
And no,
text of it, they must be watching.
What was the word?
We think all but one